Hi everybody, welcome back to my channel. Dr. Anjana Bhana here, and today we're going to be doing another treatment showcase, and it's something that is commonly used worldwide. It's a very popular treatment. It's a simple treatment, but it is very effective. It's a collagen stimulating treatment, and it's generally known as microneedling, and we are going to be doing it on our beautiful Sheetal. All of you who are my patients would know Sheetal, and Sheetal has probably done treatments on you, including microneedling and chemical peel. So today she is, as I said, my next victim. So yeah, Sheetal also needs a bit of a boost now and then, and that's what we're going to give you. Have you had a microneedling before, Sheetal? No. Okay, so this is exciting, but Sheetal's a very chilled, calm patient, not like me. I'm a red flag patient, so I know this is going to go very smoothly. Sheetal's already been numbing for about 15 to 20 minutes. You can use EMLA, or you can use, like, we write a script for this particular numbing agent. And often when I do a needling, you never forget your neck, so your face, your neck, and the French say, and we'll probably introduce it sometime this month, the French say your face ends like here, below your boobs. So we're going to introduce a facial like that. So don't just concentrate on your face. And whenever we do a treatment like this, we also go into the hairline to stimulate the hair. Okay, so you're ready to go. Okay. And then another important thing is, if I forget to mention it, we are going to be using the Dermapen 4. It's an amazing pen. It's, when we put in the needle, you can't reuse needles. It'll just like reject it. It's updated constantly. So, there's lots of cheap pens that you can buy online yourself. So be very careful. The structure of the needles, how they've been sanitized, how they've been sterilized, wherever they've been manufactured, is really important. So I would advise, try not to do these things at home. I know lots of people do, but risk of infection and adverse events is pretty high. Rather go see a professional before you embark on this sort of treatment. So when you do needling, you just don't put anything into the skin. Don't just get a vitamin C powder and mix it and needle it in. There have been cases where that has been done, where people just needle whatever in, recording in the literature where you can get a systemic reaction to whatever's needled in. So I think it was about 3 patients, and they developed arthritis, like inflammatory issues in their joints after needling, and like these serums and these things that are needled in, like this is done and made under sterile conditions, and the size of the particles are meant to be needled into the skin. We're going to make a little cocktail for Sheetal. You can see wherever the topical anesthetic has been applied, there's sort of blanching of the skin, which is normal. Some people kind of go a bit red with lidocaine. Lidocaine is a vasodilator, so it means it pumps up blood vessels. It's very important that after having a treatment like this, I'm going to go wipe this as well, that you avoid the sun. Don't go picnic and braai and whatever. Avoid extreme heat and look after your skin. No using any actives like retinols and glycolic acid for a little bit, because we have a lot of products that have those in. They're beneficial for your skin, but can be really irritating after a treatment like this. And then I wipe that off, and then I like to, either with biotin in alcohol, but that can be a bit irritating, especially after the numbing. We disinfect with hypochlorous acid, which is a little bit more calming and anti-inflammatory. So and you can needle anywhere, like any area of your body, safely. And often we like to do it around the eyes and even the eyelids, because that's really thin skin, so it stimulates collagen production there. I'm putting the serum straight on here, and we're needling. Some people dry needle, where they needle the skin first and then put the serum on. I like doing it before and after. Or they completely dry needle, where they do not put anything on the skin. It's just the stimulating power of the controlled injury of the needles going in. You okay there, Sheetal? I always start on the forehead, because the forehead is the most sensitive part. There's not much fat on the forehead, so it doesn't really take the lidocaine in very well. And also because it's thinner skin, you can adjust the needle depth on these sort of devices. And it's important to have like a really smooth motion, so no circles and all of that, because you can tear the skin. If done slowly and gently, you get a nice good result without much downtime. The problem with this is, and we were at a congress recently where they were talking about aggressive needling, and people think the deeper the better, the more bleeding the better. So erythema, this redness, is fine, as well as something called pinpoint bleeding. That's fine, but you don't have to make someone bleed and have irritated skin to get a result. Also for patients of color, it's very high risk for something called PIH, post-inflammatory hyperpigmentation, if you're too aggressive with their skin, and there's no need. There's different cells at different depths, and depending on what you want to target, just go to that depth. Like 0.5 is already in the dermis, so that's very stimulating already for collagen. And then on your cheek sheetal, I'm going to use the Hyalactive first. If you go to the side for me. So this is Hyalactive. It's hyaluronic acid with some zinc in. I'm going to put the setting a bit higher. So this is what they call a glide, so it's a bit more slippy. So it slides easily, so that, you know, there's low risk of skin tears and scarring. And you can see it's disappearing as we're needling into the skin. And then after this, I can pop in the cocktail that I mixed. When we go under the lids, because the skin's thinner, change my setting a little bit. And also, you don't forget this area here as well as the ears. You can't have like a young, fresh face and old ears. Okay, and if you to the front sheetal. Also, another thing people are doing with their earlobes are fillers, because back in the day, a lot of heavy earrings, and it would like pull the earlobe down, thin it out. So you can actually plump in filler in there, and it'll help support your earrings. Still okay? Yeah. You probably, you don't feel a thing, but you like have a, what's a tendency to go red, eh? So you'll probably be a bit red. Going to put it on your neck already. And in the hairline, how did it feel? Okay, just a little bit, yeah, tingly. Okay, under the eyelid because of the setting. Yellow. Yeah, guys, nothing to it. So nice, especially if you do it in a, like, we don't have to press down hard or anything like that. A pen like this does all the work. There's, yeah, like I said, there's lots of different pens on the market, but it's best to get something that is made properly and from a proper place. Like this doesn't allow any backflow. So whatever you're needling, blood and whatnot is not going to go back into the pen. But a lot of those cheap online pens, yes, that does happen. It can happen. And a lot of those pens online are meant as single-use pens. But with that, because there's no like tech to say, you know what, this needle hasn't been used before, the same needle can be reused. It was a patient of ours, that came in, and she was telling us of a place where you pay a certain amount for the needle and then they reuse that needle every time you come. And that's really bad because there's a lot of bacteria on the skin, good bacteria, bad bacteria, and once that needle is off, all those things are growing, and then you reintroduce that. So it's important to check that you are getting a new needle every time, and what kind of pen is being used as well. Okay, so I like to do the lips last because the mouth also has a lot of bacteria, spores, lots of things going on in the mouth. So in case we get a little bit into the mouth, you don't want that to spread along the rest of the face. But it's really nice to do the lips, especially if someone's not a candidate for lip fillers or not ready, or they have lip fillers and they do want a bit of a plumping. Okay. So it's just a little sensitive on the lip. You feel okay?
Yeah.
I even like going under, it's called the columella. Sorry, Sheetal, I didn't surprise you there. There we go. Afterwards, the patient's also really tingly, itchy. So I do spray a bit of GF spray. It is a bit shocking, but it is very calming on the skin. So if you close your eyes for me, Sheetal, take a deep breath. I'm going to spray. And then it's important to get the inflammation down. Even though inflammation is important for this treatment to work, for it to be a control wound, it shouldn't be overly inflamed and irritated. So, okay, so that's part 1 of the treatment. We still have a part 2 for Sheetal. So she's done this other procedure with us before. It's called a micro infusion, and then this is my mix. I call it the sunset mix because it looks like the sun setting. And this is, there's a few 0.6 gold-plated needles that we're going to stamp in. It's really versatile as well. So yeah, I just put some extra serum that we have, and now I'm stamping it. And whatever's left, we do give the patient to take home so they can apply during the day. Because a little goes quite a long way. I mean, with this you can do your chest, you can do your hands. So it's a really nice treatment to do. It's very popular with our patients because of the low downtime. Or if they've got an event or something the next day, they can have it done. And you can combine it with a peel. And you can make a really cool cocktail, whatever you want. So sometimes they put filler, botulinum toxin in here to give you as they call it, a glass skin facial. Okay, so on the neck there's a botanical mask called phytocorrective. And then the rest of the face, we're going to put a calming hydro jelly on. Being red after a facial like this, and depending on your patient, is normal. So we are putting this on. It's called Radiance Biotin. Very nice and calming and cold after treatment like this. It drops the temperature of the skin and reduces the inflammation. This has white willow bark in it. It has algae, biotin. Most of the ingredients are organic. Because it's hot today, it sets way faster than it would in winter. Also, I know Sheetal's not claustrophobic, but I didn't ask her, but I know. But yeah, before you put this on for your patient, please ask them, because having your eyes and your mouth covered might be relaxing for some people, but might be a nightmare for others. Okay. We like putting this here because it makes it easier to take off. But if this stuff gets into your hair or into your clothes, it's okay. It's water soluble, so it comes off really easily. Okay. Here we go. So sometimes it comes off smoothly and sometimes there's little bits. What we do is we just use a bit of GF spray and gently wipe it away before applying a post-treatment cream or mask. How's your skin feeling, Sheetal?
It's actually very, it's a bit tight.
Yeah, yeah.
It's not irritable or itchy or anything like that.
So the tightness is normal, and then you'll find that over the next couple of days it will feel like that, and then also dry, you know.
Yeah,
so
that's the feeling.
yeah.
Like a dry type feeling.
So it's like sucked in, you know, so much, and because of the microchannels created, there is a bit of, you know, water loss from the skin. So just to keep it hydrated. And I'm not going to apply sunscreen immediately because of those little micro channels, but from later on and from tomorrow, lots of sunscreen, lots of moisturizer, and also tonight, not like a super hot shower because it'll irritate the skin. So afterwards, depends on what you like. We've got a variety of post-treatment creams and post-treatment serums and masks and all of that. I'm using something called Fast Skin Repair because it's nice and rich, especially because Sheetal's like, her skin feels a little bit tight. Because I'm a doctor, I'm really bad at this facial massage thing. Sheetal's amazing at it, so I'm not sure. She's probably judging me while I'm trying to relax her post-treatment. But yes, just get it in and be gentle with it post-treatment when you are massaging the cream in. Not too much intense, rough rubbing. So massage, not rub. There we go, Sheetal. Thanks for joining me today, guys, for our microneedling adventure. And Sheetal's gone off already. But thanks to Sheetal for letting me do her treatment. And if you have any questions about microneedling, give us a call or drop your comment down below. And if you like this video, remember to like it, share it, and subscribe, please. Thank you. Bye-bye.